My name is Peter Moley. I am a physiatrist in the Department of Physiatry at the hospital, and I work in the hip center at the hospital, where I specialize in hips and low back, but also treat knees, shoulders, cervical spine, thoracic spine. One of the most common issues I see in a non-operative patient is that they have no diagnosis, whereas an operative patient, they're very clear on you have an ACL tear or you have an impingement in your hip. A lot of times non-operative is you have knee pain or you have back pain, and that's not enough. You do need to spend a little bit of time, and you have to listen to the patient. The patient will fill out, when you come in to see me, you'll fill out a intake form of what's going on. Many of our patients we put into registries, so we want to look at long-term, how are you doing, are our treatments working? But the main thing is your history. You're going to sit down and tell me what's wrong with you. Most of the time after the history, we know what's happening. So we need to be able to listen to you and your history. So all our other data we're going to apply to that, but you're going to tell me what's going on. The history and physical exam combined are very important. So 90% of what we're going to need, we're going to find there. Then, if it's not all there, our basic imaging is not enough, we can do advanced imaging. So to get a proper diagnosis takes a bit of time. Everyone's going to have a different therapy process that is going to be unique, individual, and there are going to be successes that mean someone can walk, success that means that somebody's back playing professional sports. And so we have to just make sure we understand where we're trying to get to for the patient to be satisfied. In the end, you should not only feel better, you should be a bit stronger, you should understand what activities you can do, and you should have a plan. When things aren't going well, how do I get back to feeling well? So it very much empowers the patient to be their own caregiver once we've educated them.